Hi, my name is Kwekwe. I'm a pharmacist. In today's brief video, I'm going to be discussing the medication Amlodipine, also sold under the brand name Norvasc. We're going to be taking a look at what it is used for, some dosage information. We're going to take a look at some side effects, as well as some precautions or general best practices that you should be aware of if you are taking Amlodipine or if you are considering. As always, this and all my other videos are for informational purposes only, so please do not stop, or make any changes to your medications without first talking to your doctor about it. So to start with, what is Amlodipine? Well, Amlodipine is a prescription medication that is approved for three primary reasons. Number one is the management of hypertension, which seems to be the most common use of Amlodipine. It is also approved in managing certain kinds of chest pain, which we call angina, as well as in the management of coronary artery disease, where there is narrowing of the blood vessels that supply the heart. Amlodipine belongs to a class of medications we call calcium channel blockers, and these exert their effect primarily by relaxing the blood vessels. So when the blood vessels are relaxed, they are able to expand, the diameter is increased, and there is reduced resistance to blood flow. In other words, the blood is able to flow freely through a bigger diameter compared to a narrow diameter where resistance will be high and therefore blood pressure will be high in that instance. Now, with respect to dosing, you see anything ranging between 2.5 to 10 milligrams taken daily. It's not unusual to see people started on 5 milligrams and then they kind of work their way up to 10 milligrams, which seems to be the most standard dose when it comes to its use in the management of hypertension. In other words, I see more 10 milligram prescriptions than I do see of the other strengths. Now onto some side effects, and the most common one is edema, which is fluid retention, usually resulting in swelling of the legs, the ankles, and the hands in some people. Now, this tends to be dose related. In other words, the higher your dose, the greater the risks of developing edema. So a lot of the times when people start taking Amlodipine and they experience edema, one of the first things that the doctor will do will potentially decrease the dose. That is, if they're already taking a higher dose, to see if that resolves the problem. Now, edema is relatively common. Like I said, it's about the most common side effect you see, occurring in about 10.8% up to about 10.8% of the people that take it. In other words, every 1 in 10 people taking Amlodipine may experience this edema at some point in time. Other side effects include nausea, occurring in about 1.6% of the population, abdominal pain, about 2.9% of the population, and somnolence, which is an intense desire to go to sleep or to go to bed. Headache has also been reported, as well as sexual dysfunction, which may be manifested in the form of either erectile dysfunction or a decreased libido. Now, you're going to see this in about less than 1% of women and about 2 or less percent of men that take Amlodipine. Now, and what I usually say about sexual dysfunction, if you've watched this channel for any length of time, is that it is in itself not a reason for you to discontinue your medication, because at the end of the day, high blood pressure itself is a risk factor for developing, some of these sexual dysfunction. So the best way around this is to actually have a talk with your doctor and find an alternative that works for you. At the end of the day, you have to be alive to be able to have sex anyway. So what's the point of not taking your medication and then you cut your life short? That also will cut that pleasure short. So I highly recommend that people do not discontinue their medication just based on that, because I see it quite too often and it's sometimes very alarming. Another observed side effect is muscle cramps or muscle pain, occurring in about 2% or less of the population. Now, this may be more pronounced, or this may be aggravated if you're already taking another medication that also has a side effect of muscle cramps. And one typical one that I can think about are a group of medications called statins, which are used to manage cholesterol. So we have atorvastatin, pravastatin, and that family. Now, this is not to say that Amlodipine can never be taken with statins, because I literally dispense hundreds, thousands of prescriptions where people are taking both. The only thing is that the statins already have their problem with muscular pain and muscular cramping, and therefore if you add Amlodipine, which also has that effect, then you kind of increase the risk of that happening. So if you are taking, especially if you're taking both medications and you experience anything like that, do well to kind of have a discussion with your doctor, let alternatives be sought for you. But it's rare, occurring about 2% or less of the population. So most people are able to tolerate it without any problems. Other side effects reported include upset stomach, dizziness, and flushing. Amlodipine causes dilation of the blood vessels. So there is increased blood flow to the capillaries of the skin, usually the face. So that is what results in that redness or that warmth feeling when you take medications like amlodipine that increases blood flow. Now on to some few precautions. And the first one is that amlodipine may worsen angina for some people. I mentioned that amlodipine may be used to treat certain types of angina, but for some people, when they start taking it or when there's an increase in the dose, they notice that the frequency of their angina attacks becomes increased or becomes more. Especially for people who already have COPD, chronic obstructive pulmonary disease. If you have COPD or anytime you take amlodipine and you notice an increase in the frequency or the severity of your angina, it may be a good time to start talking to your doctor to see if everything is okay. Irregular heartbeats, or what we call arrhythmias, have also been associated with people taking amlodipine. So if you experienced any rapid pounding, any kind of change in your heart rhythm, it will be a good time or a good thing to discuss with your doctor to see if everything is okay. And then also, amlodipine in very rare cases has been associated with hypotension, where your blood pressure goes too low, and for some people it may go low enough that they may experience fainting. So if you experience any kind of fainting feeling, dizziness when you take amlodipine, it will be a good idea to discuss with your doctor to make sure that everything is okay. This is a high-level overview of amlodipine. On your screen now is a video that I did answering the most frequently asked questions about amlodipine. I guess by looking at that video, a lot of your questions that you have will be answered. Thank you for staying through. I'll catch you on the next video and stay blessed.